Why do we urinate more often at night? Have you ever noticed that you need to run to the bathroom more often than usual, especially during the night? If you find yourself waking up to urinate more often and your sleep is affected, you might think it's just a matter of drinking too much water before bed. But the reality is that there may be deeper causes behind this condition, and recognizing them early can make all the difference. Why do we urinate more at night? As we age, our bodies undergo physiological changes that can affect urinary function. The production of antidiuretic hormone, ADH, decreases, reducing the ability to retain fluids during sleep. This hormone is essential for fluid balance, and its reduced production causes the kidneys to filter more urine at night. In addition, lying down promotes the return of liquids accumulated during the day into the bloodstream, stimulating diuresis. Those who suffer from water retention, congestive heart failure, or kidney problems may experience a significant increase in nighttime diuresis. However, it is not only age that affects the frequency of urination at night. Some factors such as the intake of diuretic drinks, tea, coffee, alcohol, fluid retention, and stress can worsen the situation. In addition, various medical conditions can be at the root of this problem. The use of certain medications, such as diuretics, antihypertensives, and antidepressants, can increase the need to urinate, as well as neurological disorders that alter bladder control. Diet also plays a role. Excessive salt consumption can promote water retention, increasing urine production at night. Similarly, a diet rich in refined sugars can affect insulin levels and fluid metabolism, leading to increased urine production. When to worry? Urinating once a night may be normal, but if the phenomenon occurs more than once and affects the quality of life, it is good to investigate the causes. Some warning signs include a weak or interrupted stream of urine, which could indicate prostate problems. Burning or pain during urination, a symptom of possible urinary tract infections. Sensation of bladder not being completely emptied. Increased thirst and fatigue, which could be signs of diabetes. Presence of blood in the urine, which may indicate kidney stones or other more serious pathologies. Pain in your lower back or abdomen, which may be a sign of kidney infections or bladder problems. Involuntary loss of urine or incontinence. If one or more of these symptoms occur, it is advisable to consult a doctor to avoid future complications. Sometimes, frequent urination can be linked to more serious conditions such as kidney failure or autoimmune diseases that affect urine production. 3 medical conditions that can cause frequent urination. Urinary tract infections. A urinary tract infection may start with mild symptoms, but if left untreated, it can progress to more serious kidney problems. Medical studies have shown that urinary tract infections are more common in women due to the anatomy of the urethra, but men can also be affected. The presence of bacteria in the bladder causes inflammation that makes it difficult to hold urine, causing frequent urination. Benign prostatic hyperplasia, BPH in men over 50, a benign enlargement of the prostate can impede the normal flow of urine, causing frequent urination and difficulty emptying the bladder completely. This can lead to an increased risk of infections and a reduced quality of life. Regular checkups and drug treatments can help alleviate the problem. Diabetes. When blood sugar is too high, the body tries to eliminate excess sugar through urine, leading to profuse urination and constant thirst. Clinical studies confirm that polyuria is one of the first symptoms of undiagnosed diabetes. It is important to monitor blood glucose levels to detect metabolic imbalances early. How to reduce nighttime urination. If you want to improve the quality of your sleep and reduce nighttime interruptions, here are some practical tips. Regulate hydration. Drink water throughout the day, but reduce your intake in the evening hours. Avoid diuretic drinks. Coffee, tea, and alcohol stimulate urine production, so it is best to limit them in the evening. Elevate your legs in the afternoon. This helps the body drain accumulated fluids before going to sleep. Empty your bladder before bed, a simple habit that can reduce the need to get up during the night. Practice pelvic floor exercises. Kegel exercises can help improve bladder control, reducing involuntary leakage. Manage stress. Tension and anxiety can affect the nervous system, increasing urinary frequency. Relaxation techniques such as meditation and deep breathing can be helpful. Maintain a healthy weight. Being overweight can put too much pressure on your bladder, making it harder to control your urine. Modify your diet. Reducing your intake of salt and refined sugars can help stabilize your urine output. When to see a doctor? If symptoms persist for several weeks despite lifestyle changes, it may be time to see a doctor. A urine test may reveal the presence of infections or metabolic imbalances. In some cases, ultrasound or specialist tests may be needed to evaluate any abnormalities in the bladder or prostate. Conclusion: our body communicates through small signals, and urinary frequency at night is one of them. Recognizing the causes and adopting targeted strategies can make the difference in improving rest and quality of life. Sleeping well is essential for physical and mental health, and reducing nighttime interruptions helps you feel more energetic during the day. If you found this content helpful, subscribe to the Soul Flame channel to receive more advice on your health. And if you liked this video, share it with those who could benefit from it.